Alrighty, this is Dr. Cohen. I'm here with Bryan. Bryan came down from the Northern California area. He had a neck surgery, cervical spine surgery with Dr. Rudin, and he ended up having both of his carpal tunnels done within under a 1 week period. So I want to ask you some questions. First question is, how did you find us from where you live in Northern California when you really don't have many connections down here, or certainly medically? How did you find us down here in Westlake Village?
Actually, Google, Google reviews. So I was interested in trying to find the best care I could. So I spent a number of hours on Google and looking at different doctors and providers. And the thing that really made me choose this office was seeing how many other hand surgeons and other surgeons were treated by you. And so that's kind of the main thing. I'm like, I want the guy that the surgeons are seeing. So
great. And then, of course, I don't really think you had much of an idea that you need neck surgery until we looked more carefully at your neck. A lot of people don't know, but the nerves that start in your neck end up in your fingertips. Not all of them, but most of them. And along the way, they can be compressed anywhere. So most people have it in one place. Unfortunately, you had it in multiple places, and you needed fairly extensive surgery on your neck and on both your wrists. So when you called the office the first time to set up the appointment, how was your experience with that?
So my experience was so good with the front office staff that I didn't even, after that point, call anyone else. Usually, I'll call a bunch of places and, try to gauge my experience from that. But I just was amazed, and they said, hey, we don't know the answer to that. We'll call you back. Give us 15 minutes. Get the word, call back 15 minutes. And I've never, ever had a problem with communication. It's always been so fast and so easy. So that it's just been phenomenal.
That's great. And that's what we try to do here. We want to be responsive, responsible, and take care of people how we want to be taken care of. So you came down, you and I met for the first time. We did an examination, tried some things. Did you feel pretty confident that we had tried all the measures we could before doing surgery?
Absolutely. That was one thing I was really appreciative. We tried all the conservative methods first. And since those weren't working, then we progressed further. So I appreciate you not jumping the gun there.
Sure. And then what did you think in terms of, one of the things we pride ourselves on here is that we take time with our patients. What was your initial impression of the first exam and what you and I went over and the time we spent talking about it?
I would say that would be the second most impressive thing over my whole experience. The first thing I would say is the expertise, the level, how fast I'm healing and everything. But that would be my second most impressive thing. I cannot believe the amount of time that has been given. It's the highest form of respect to give someone your time. There's no rush. All the doctors and staff were very, very punctual, very accommodating since I'm traveling, so some things changed with that. Very accommodating on that end, so fantastic experience there.
Great. And then how was your experience with Dr. Rudin?
Marvelous.
The neck doctor.
Marvelous. To be honest, at first I was a little worried because he was so, comfortable and confident, and you hear all the horror stories about neck surgery, back surgery. So I was very worried at first, but then once again, just hearing all of his experience and everything, I was like, all right, let's do this. Let's go for it. And I would not choose anyone else at all. Just the second I woke up from surgery, I could start moving my neck and just ways I could never even do just from the minute I was conscious from surgery. So. And
you had 2 discs replaced?
2 discs, yeah.
Great. And I know that we had tried to do simultaneous, neck and wrist surgery with he and I both operating in the same operating room at the same time, but there were some snafus with insurance and payments and things like that. How did you think the office handled that aspect of it?
That was marvelous. That's the worst thing is to, have all the reservations and accommodations booked and everything. And I was like, oh no, now I'm gonna have to reschedule. But the level of accommodation there was amazing. They basically, I don't know what they did on their end, working their schedules, but I did the neck surgery on a Thursday, and then was able to follow up with your surgeries, both wrists, a few days later. And so, you know, you put it in such a close time span that it didn't affect me at all. And billing, all that kind of stuff just flowed as smoothly as possible. So even though it wasn't something on their end that ended up, you guys went over and above to help get that back on track.
That's very good to hear. Very good. So now it's been 8 days since you had your neck surgery, and it's been only since Monday that we did both your wrists.
Mm-hmm.
And you've already been in therapy for your wrist.
Mm-hmm.
There's no therapy necessary on your neck, but there's been therapy going on for your wrist since Monday. Today's Friday. And you were mentioning to me a couple minutes ago that since you're down from Northern California, you actually were able to walk 7 miles in Malibu within days of having 3 surgeries done. So that's fantastic that you're able to do that. Let me ask you a question now. Can you show us your range of motion in your neck?
Sure, absolutely.
Great. And the
Which is the best I think I've actually ever had to my recollection. So just phenomenal.
That's big improvement. The main reason you had surgery on your neck, was it neck pain or numbness and tingling?
Both. So a lot of my experience was it felt like my discs were being smashed together. And so I'd get a lot of radiating pain from that would go down both arms. Always sore, very uncomfortable. It hurt to tilt any more than, say, this range of motion at all. So whether I was exercising or not exercising. So that was the symptoms, and then shooting all the way down the arms and tingling and numbness.
So fast forward to today, 8 days since you've had 3 surgeries. How much numbness and tingling do you have at this point?
I have no numbness or tingling whatsoever.
Great. And then on your hands, so we did my standard open carpal tunnel release, which is where we make the larger incision. I don't use a camera or a scope. I don't make a small incision. I find that people rehab rather quickly. One of the main selling points on doing the scope is that patients get to return to function and work more quickly. My impression of that is that that's not true when I'm doing it. The return to work and function is equal. And I find that there's no doubt that the carpal tunnel was completely released through direct vision in my hands, the safest manner possible. So your experience with open carpal tunnel releases, can you show us your range of motion?
Sure.
Okay, good. And then upside down. Good. Palms up. Palms down. Make a fist. Straighten out. Good. And then are you able to squeeze this for me?
Sure. Just really.
Good enough. Perfect. And then here's 5 pounds. Just try lifting that. Good. Perfect. So you still have sutures in there that won't be out. Your sutures are absorbable because you're from out of town. And we'll do a FaceTime call next week, you and I, to see how you're doing, what's going on. You'll be in touch with a therapist. They've already given you a home exercise program. You've done really well with this. For people in the land of the internet, we don't typically do both hands the same day. I will, in somebody who I know can handle surgery on both hands and has good support from siblings, spouses, parents, whoever it might be, so that they have help in the bathroom, brushing their teeth, combing their hair, things of that nature. And I'll be more inclined to do it with someone who's from out of town, to save them another trip down here for additional surgeries, additional anesthesia, additional therapy, things of that nature. So you've done remarkably well with all of this, and I think people can see from your progress that as much surgery as you've had, and as substantial as this surgery is, especially your neck, that you sailed right through it.
If they would let me go back to work next week, I would be willing and able to do it. I mean, I could never move my fingers as well even before the surgery, so I feel like I'm not being restored to what I was, but now actually enhanced. So, I don't know how that works, but it's my quality of life is just 1,000% what it was, and my mind is so much clearer because I'm not trying to compartmentalize the pain. So it's just
right.
the hugest blessing.
That's great. Well, I want to thank you so much for taking the time to share this with people. I know that you really wanted to do this because one of the ways that you found us was through these type of videos and testimonials. And honestly, I feel like having you talk about this is more important than watching me hold a scalpel in the operating room and demonstrate a procedure that most people don't even know what they're looking at. More important than that is your experience with my team, my office, my partner, Dr. Rudin, and everybody here. So again, I really appreciate your taking the time and explaining this, and I wish you the best of luck.
And if anyone would like, I would be willing, if they can provide a way we can communicate, email or something, I'd be happy to, help anyone if they would like more questions, because it's a scary thing to go through surgery. So
yeah, for sure. Anybody who reaches out to my office who wants to talk to you, we will get that person's phone number and give it to you.
Fantastic.
And have you call them, and we appreciate that. And I know patients really appreciate that, because hearing it from someone else in person or by phone means the world to them. And I actually have patients who've shared similar procedures in the town here who met before surgery.
Oh, that's cool.
And have become friends since.
Mm-hmm.
So it's fascinating. All right, good.
Last thing I gotta say, so if I were to sum the whole thing up in 2 words, it would be compassionate and competent. So the whole staff knows exactly what they're doing. They're the best, and they give you the time, respect, and you end up being friends. So.
And then I'm going to ask you this because people have a hard time believing. So I'm going to ask you a couple questions. Number one, are we related in any way?
No.
Number
I actually
two,
requested this.
Yeah. Are we paying you to do this?
No.
Thank you. Okay, good. Well, again, I appreciate your taking the time to do this, and good luck.
Thank you.